Assalamu alaikum everyone. My name is Saviya Kashif. I'm MPhil student at College of Molecular Medicine, Saudi University, and I'm here to present a part of my MPhil research. And the title of my research is Preventive Role of Dasmatine in Amyloid Beta 2535 Induced In Vitro Alzheimer's Disease Model. I'll start with the basic introduction of the disease. As we all know that Alzheimer's disease is a progressive neurodegenerative disorder. It is the most common type of dementia, accounting for about 60 to 80% in cases of dementia worldwide. As the disease progresses, it leads to the gradual loss of neurons. Because of this, patients start to lose their memory and thinking ability, and eventually the ability to carry out the basic task is lost. If we talk about the global prevalence, it is reported that 6.9 million people in the world are diagnosed with Alzheimer's disease. And in next 5 years, it is reported that 7.7 million people in the world could develop Alzheimer's disease, and around 46% of that population could be Asian. So it is a very alarming condition for Asian population as well. If we talk about the pathophysiology of Alzheimer's disease is very complex and not dependent on one pathway or mechanism. It can be credited to cholinergic dysfunction, amyloid and tau toxicity, oxidative stress that leads to the mitochondrial dysfunction. One of the key problems is the elevation of amyloid beta levels. When amyloid beta levels increases, it leads to the aggregation formation and the formation of the plaque, which leads to the hyperphosphorylation of tau and ultimately causes the neuronal loss. If we talk about the current treatment, there are only few drugs that are approved by FDA, and all of these drugs are mostly for the treatment of the symptoms rather than the cure of disease. So we opted for the natural compounds because as we know that nature is compatible with nature. And nowadays, natural compounds are favored over synthetic drugs due to their traditional history, less toxicity, and cost-effective properties. The compound that we chose is diazmetine, as it is reported to have anti-diabetic, antioxidant, neuroprotective effect, anti-cancer effect, and also reported to protect the normal cells. The reason for going for this compound was because its neuroprotective effect is reported, but through which mechanism it is still not known. The research question was, does diazmetine prevent amyloid beta 2535 induced neuronal cell injury? The objectives were to develop amyloid beta 2535 induced in vitro Alzheimer's disease model and to evaluate the preventive role of diazmetine in amyloid beta 2535 induced in vitro Alzheimer's disease model. And the third objective was to evaluate the mechanism through which diazmetine is producing its beneficial effects in amyloid beta model. If we talk about the methodology, the study setting was MDRL 1 and 2, Saudi University, Clifton Campus, Karachi. And the target specimen was SHSY5Y cells. Study design was preclinical in vitro study, and the study duration was 9 months after the approval from GEC, ERC, and BSR. This is a sequence of procedure. First, the cells were cultured and the cells were differentiated. As the SHSY5Y cells are neuroblastoma cells, they were differentiated into neuron-like cells. After that, the establishment of Alzheimer's disease model was done using amyloid beta 2535. Cell viability assay was done to find out the optimized dose for the model development. After that, development of the dose-dependent groups of diazmetine was done to find out the most significant dose of diazmetine that is producing the most beneficial effects. Immunofluorescence and immunocytochemistry was done. Moving on to the results. First, I'll discuss the results of amyloid beta 2535 on the cell viability. This is a model development step. We can see here at the 0, this is the control group. We can see the 100% cell viability. But when the cells are treated with the increasing dose of amyloid beta, we can see the reduction in the cell viability. We wanted to find out the dose that is producing the effect at 50 to 60, that is producing 50 to 60% cell viability, and we use that dose for the model development. And for that dose, we found out that 40 micromole is the most effective dose for that purpose. So we use that dose for the development of the model, and it is supported by previous literature that in SHSY5Y cell, this is the dose that is used for the model development, while the dose varies through the different different cell lines and different models. If we talk about the effect of diazmetine on the cell viability, the cells were pre-treated with diazmetine as it is a preventive model. So we can see 100% cell viability at 0. And then this is amyloid beta group that is only treated with the 40 micromolar of the dose of amyloid beta. And then the cells were treated with increasing dose of diazmetine. And we can see here that diazmetine is significantly preventing amyloid beta induced cytotoxicity in the dose-dependent manner, and the cell viability is ranging from starting from 60 at 1 micromolar and going till around 90 to 95% cell viability at 80 micromole. For further validation of this, we also did the PI and DAPI staining to find out the effect of amyloid beta and diazmetine on cellular injury. We can see this is a control group. In the control group, there is no cellular injury. But when the cells were treated with amyloid beta, we can see the exposure of amyloid beta exhibited a marked increase in the cellular injury indicated by strong red fluorescence intensity, while when the cells were pre-treated with diazmetine, there is a contrast in the results that is showing that there is a significant reduction in the cellular injury demonstrated by higher DAPI, that is the blue color staining, reflecting preserved nuclear integrity and decreased cell death. These results indicate that diazmetine effectively protects the SHS5 cells from the neuronal toxicity and cytotoxicity that is produced by amyloid beta. These are the results of the effect of the pathways. We added the inhibitor of different pathways to find out through which diazmetine is producing its effect. We added the inhibitor of ERK1 by 2 pathway. We can see here when the inhibitor, this is a diazmetine treated group, but when it was treated with the ERK1 by 2 inhibitor, it is reducing the effect that is produced by diazmetine. So we can say that diazmetine is exerting its effects through ERK1 by 2 signaling pathway. For further validation, we also did the cellular morphology assay and to find out the effect. This is a control group. We can see in the control A, the cellular morphology of the neurons is intact and the nuclear network, cellular network is established here. But when the cells were treated with amyloid beta 2535, the cellular damage is pronounced, as we can see the shrinkage of cells and loss of structural integrity and reduced cell density. While when the cells were pre-treated with diazmetine, there's a noticeable improvement in the cellular morphology and cells looks more preserved. While when the cells were treated with the inhibitor of ERK1 by 2 pathway, we can see the similar results of that if we compare it to the amyloid beta. So it is showing that it is ERK1 by 2 inhibitor is preventing diazmetine to produce its beneficial effects, and it's stopping diazmetine to protect the cells against amyloid beta 2535. To further validate this, we also checked the effect of it on cellular injury. These are the results from the previous slide that I've shown. This is a control group. This is amyloid beta group where we can see the cellular injury. But when the cells were treated with amyloid beta 2535, before that they were treated with diazmetine, we can see the cellular injury is reduced. But when the cells were treated with the inhibitor of ERK1 by 2 pathway, we can see the results are similar to that of amyloid beta group, and the cellular injury is visible here as the red fluorescence intensity is visible. So we can say that diazmetine is producing its effect through ERK1 by 2 pathway when the inhibitor is added. So it is not producing its effect. So this validates our results. To further, we also did the check the effect of amyloid beta and diazmetine on tau hyperphosphorylation expression of tau protein, because as I previously mentioned that when amyloid beta aggregates are formed, they lead to the hyperphosphorylation of tau. So to validate that, we also validate the establishment of model. We also did that. We can see this is the control group. There is no expression of tau hyperphosphorylation, but when this is amyloid beta 2535 treated group, and the hyperphosphorylation of tau is clearly visible here, while these are the diazmetine treated group. So we can see that diazmetine is also preventing the hyperphosphorylation of tau. So this is my conclusion that aspartame effectively prevents the amyloid beta 2535 induced neuronal damage by reducing apoptosis, activating ERK1 by 2 dependent signaling, and preventing tau hyperphosphorylation in neuronal SHS5 cells. These results supports diaspartame as a potential neuroprotective candidate for the further therapeutic development in Alzheimer's disease research. These are my references. Thank you so much.